to our listeners. Welcome to another edition of Your Health Matters on Kaieteur Radio. I'm your host, Rehanna Ramsay, and today I have with me Dr. Mahindra Karpin, who is the head of Medical Services and Cardiology at the Georgetown Public Hospital Corporation. He's here to discuss with us today matters concerning the COVID-19 immunization or vaccination. And we will be talking about all the concerns and benefits of taking the vaccines. Welcome to the program, Dr. Karpin. And if you want, you would introduce yourself and share a bit more.
Thank you very much, Rehanna, for having me on the program today. And let me thank the Kaieteur family in general for all the promo work and all the assistance you've been giving to us as healthcare providers in sensitizing the public, in educating the public, and making sure that the right information reaches to the Guyanese public at large. I must apologize for being a couple minutes late. You know, even in COVID, we still have people coming into hospital with heart attacks. They still need to have their angiograms done, their stenting done, etc. And of course, midday traffic in Georgetown is always a challenge to navigate these parts. So,
I know.
But I'm happy to be here nevertheless.
And you're forgiven. I'm sure that the viewers and listeners are willing to forgive.
You have a very generous audience.
Sure. So one of our main concerns since the COVID-19 immunization program was started to roll out is why is this? I know COVID-19 is a deadly virus and all of that, but why is it important for persons to take the vaccine?
So vaccines in general are designed to do two things when it comes to diseases. One is to prevent the individual from becoming sick with that infection, yes. And two, to disrupt the spread. So COVID-19, the name COVID, C-O-V-I-D, it really means, C-O means coronavirus, V-I is virus, and D is disease. 19 is the year in which it was discovered, 2019. Now, this is new to us all, and we yet do not have a magic bullet. But there is a well-known tenet in medicine that prevention is better than cure. Vaccines historically have been one of the methods that we employ to promote prevention in diseases. And Guyana, I am proud to say, has a very strong record of immunization and vaccination for our population. There is a very well-organized, well-experienced team of public health officials that have provided service over the years to the Guyanese public. And we have all been immunized with MMR, measles, mumps, rubella shots. We've all had tetanus shots. We've all had the polio oral drops. All of these are known vaccines that have, over the decades, proven to be effective in preventing disease and therefore leading to reduced numbers of deaths and disability due to these preventable infections or diseases.
For those who might want to say, okay, is this vaccine optional or is it compulsory? Could you speak to that?
Well, we're very grateful that we live in a free country. And so we have not yet reached the stage, and I hope we don't, that we force people to take medication, that we force them to take vaccination. We can only educate people. And if we do our jobs right, then people will come to that decision themselves to recognize that they actually need to do this for their own safety, for their own health. This is how they protect themselves. This is how they protect their families, those who they work with, those who they go to church with, all the vulnerable people around them. Vaccines are not just for the individual, but for the community.
Yes. Sure. And I know that you were among one of the first persons to benefit from the immunization,
Yes.
um, uh, immunization campaign. Um, could you tell us about your experience?
Oh.
What was it like the day after when you woke up? Because people would want to know.
Yes, of course. I'm very happy to share that experience with you. I was, yes, indeed, very fortunate to be among the first group of healthcare professionals, the first group of Guyanese in Guyana to receive the vaccine. I got mine at the Georgetown Public Hospital when the ministry rolled out their vaccine campaign on day one. And it was a very seamless process, actually. Of course, it's a big event, so there was a lot of media presence, a lot of ceremonial activities that accompanied the rollout of the vaccination program. But when you went into the area that they give the vaccines, there are two clerical staff that are taking your data. They're asking your name, date of birth, address, telephone numbers. Then they find out from you, do you have any medical conditions that may prevent you from taking this vaccine or make you more suitable for the vaccine? They want to know, any medical condition, any medications that you might be taking. You do that, and then they actually, create a vaccination card for you. They give that to you, and they send you to the actual nurses who are doing the vaccines. Now, on day one, there were a couple people ahead of me waiting to get their vaccine. So you sat on a stool and waited your turn. When it was my turn to go up, the nurse showed me the vial after I exposed my left shoulder, because I took mine in my left shoulder. I'm right-handed, so I wanted to, maintain use of my right hand.
Yes.
Now, the injection, we know we have excellent nurses, but mine was particularly special because I didn't feel the needle at all. And just like any injection, just like any vaccination, it was over in a second. And this was after the nurse showed you the vial and said, this is what you're going to get. You saw her pull it up in the syringe, inject the site, and put a little cotton wool on it to make sure that, there is no oozing or bleeding, etc. Then you went to the next section of the vaccination room to have a seat, just waiting there for the next 15 minutes to make sure that there are no abnormal reactions, etc. And one of the things that was quite important to note, that in the vaccination area, it's set up to deal with any abnormal acute reactions. There are beds there with resuscitation equipment and medications just in case, somebody collapses, for example, or develops a severe allergic reaction. So it's a prepared process. It's well thought out. It's something that we have been doing in Guyana for decades. It's just a new vaccine, a different vaccine.
And this would be the standard way of doing things for all persons receiving the vaccine or set to receive the vaccine, or is this just because you are a...
No, this is the standard across the country. And you asked about, what happened afterwards. I got the vaccine. I went back to work, saw my clinic patients, continued to operate on those who needed to be operated on. I took 2 Tylenol in the evening because I started to feel some chills. And for your listeners and viewers, Tylenol is the same as Panadol and paracetamol, the same active ingredient. So I just took 2 of that, and I was quite fine. The next morning, there was no break, just continued working, back to clinic, back to operating.
And there are 2 doses. Why? You talked about a bit of side effect, because that's normal, I would assume.
Any injection you get, you expect some discomfort at the site of injection. It's a needle going into your arm. So there is a little bit of pain there, maybe not at the same time. Like I said, I had a very good nurse to give me. But there was a little soreness later. Again, the Panadol took care of it quite well. And then, the fever and chills lasted for a couple hours. Once the Panadol took care of that as well, there was nothing lasting afterwards.
Just to help us understand, we know that there are 2 doses why is this immunization? Why does it have? Why do you have to take
Yeah.
2 doses instead
So-
of 1?
The trials were done to get the maximum immune reaction from the vaccination. And the results showed that the best immune reaction occurred when you got the initial vaccine and then the second one, which acted like a booster. And initially, we started out thinking that 3 to 4 weeks after the first would be the best time. But as more and more data became available, we have just recognized that, especially for the AstraZeneca vaccine, the best benefit is derived if you give the second dose about 3 months after the first injection. That's when you have the best immune response. Your body can now develop antibodies or soldiers to fight against the real coronavirus should you encounter it.
So basically, you would have only gotten 1 dose, or
I would have gotten 1 dose, like everybody so far in Guyana. No one, I believe, would have had 2 doses. We haven't been doing it for so long yet.
okay. So we're talking about the COVID-19 vaccination process, and we know that the Ministry of Health has rolled out a campaign to have those who are eligible vaccinated so that they can protect themselves and those around them from contracting the deadly virus. Could you speak to the eligibility of persons who would?
Yeah. So ideally, we would like to vaccinate every citizen or every resident because it doesn't spare persons who are not citizens. If you're in contact with a person, regardless of their nationality, gender, socioeconomic status, one person can pass it on to another. So ideally, we would like to vaccinate everyone in the society. Because of scarcity of vaccination doses and resources, we have to prioritize. And so we start with the most vulnerable group. The most vulnerable group, as recommended across the world by WHO and all the other authorities, starts with healthcare workers. And these are not just doctors and nurses. These are the janitors who work in the hospital. These are the pharmacists, the technicians, the maids, the people who transport patients on trolleys and wheelchairs. These are all essential workers, and we have a lot of dedicated essential workers in Guyana. Now, that's the first line. The second line are persons who are older, and that in Guyana we say 60 and above. But then you have persons who are younger, but also have what we call comorbid conditions. Comorbid conditions mean underlying diseases that can contribute to morbidity and mortality. That is death and disability. And that includes things like heart disease, diabetes, hypertension, kidney disease, blood disease, all kinds of stuff. And those persons are at particularly high risk for mortality and morbidity. So hence, we want to capture those persons. The least risky group is the person 18 to 35, 45. But then again, in Guyana, many people are walking around with undiagnosed medical conditions in their 30s, in their early 40s. So it's a little bit different for us because of our challenges with preventive care and primary health care, etc. Ideally, we would like to have everyone vaccinated, but right now we're starting with the known priority groups who are at highest risk for death and disability.
In terms of persons who are not eligible, I understand that children can't take the vaccine. Persons who are pregnant. Could you speak a bit more to that?
So, the early trials which we've used the evidence from to base our guidelines did not really include children. Now, the major companies are currently running trials on children and pregnant mothers, etc. The results should be available within coming weeks to months, and therefore we can then make informed decisions about that. We're just looking across the world. The pandemic has affected children, no doubt about it. But the hospitalization rate, the death rate, the ICU admission rate in children has been very low. It's encouraging. And of course, we understand that one death is too many, especially when it comes to children. But, these are things that we have to face reality about.
Mm-hmm.
That, it can happen, but
And
right
such a
now
big issue.
that's the lower risk group.
Okay, so we'll just take a short break, and when we come back, we will talk to Dr. Mahindra Karpin more and have him talk to us some more on the immunization process for COVID-19.
Sure, thanks.
Welcome back to the program. You're here with us on Your Health Matters on Kaieteur Radio, and we have joining us today Dr. Mahindra Karpin, who is talking to us about the COVID-19 immunization process. And we were talking before we went to break about the eligible persons and those who are not eligible for the vaccine, what they should do. So, Dr. Karpin, just tell us, those persons who cannot take the vaccine, how do they safeguard themselves?
So that's a very interesting and important question. And thankfully, there are very, very few persons who would fall under the category of absolute contraindication to taking the vaccine. And I want to make that very clear, because ever since we started out the vaccination program, I have been called several times a day by friends, family, acquaintances, patients, called or messaged about people's concern whether or not they should take the vaccine. And I have to tell them, based on the scientific data that is available, the only group of persons that should absolutely not take the vaccine are those who are known to have severe allergic reactions to vaccines in general or any component of the COVID-19 vaccine, regardless of the company. Only those with severe allergic reaction. So let me go through that a little bit. People with heart disease. I'm a cardiologist. So all my patients come to me, Doc, I had a heart attack. Is it safe for me to take the vaccine? Based on your heart attack, yes, you can take the vaccine. In fact, you should take the vaccine because you are higher risk of dying from COVID-19 than you are of having a problem with the vaccine. Doc, my heart races. Should I take the vaccine? Yes, that is not a reason to stop you from taking the vaccine. Heart failure patients, all of those patients, heart rhythm problems, people born with holes in the heart or what we call congenital heart disease. These are all persons who are at higher risk of contracting and getting bad outcomes from COVID-19. So they should absolutely protect themselves by getting the vaccine. The other question that comes up is, okay, I'm on medications for this disease, XYZ. Should I take the vaccine? Is there any interaction? Well, the data is there, or quite clear, that there is no recognized interaction with any of the standard or any of the top 10 prescribed medications. And this is places like the US and across Europe. No interaction with your medications and taking the vaccine. The only thing that people are a little cautious about is sometimes if you are on blood thinners, like any injection, if you're on blood thinners and you take an injection, there is a possibility that you could have bleeding at the site of the injection. And so they would advise that you apply pressure a little longer than the usual vaccination process. So again, to come back to your question, it's very good that very few people fall in the category of absolutely no taking of the vaccine. And for those persons, you have to follow what are the practical recommended guidelines. And these remain the same. Wear the mask all the time.
Wash your hands.
Wash your hands, sanitize your hands, maintain social distancing. And, if I have my way, people would be taking lots of vitamin C and zinc and, those kind of stuff.
And vitamin D.
And vitamin D as well.
In terms of those persons who would have already had COVID-19, what is the effect of taking a
It's
vaccine?
a great question. As you know, we're past 8,000 persons in Guyana who have tested positive for COVID-19. By estimation of CDC and WHO, etc., if you have one person test positive, multiply that number by 8 to get the real number.
Wow.
So if you were to follow that logic, we probably would have had about 60,000 persons. The majority will recover well and probably not even know that they had COVID-19. So, this is important to note that you may have had COVID-19, but we do not know how long the immunity that develops from the actual infection would last. So it is still recommended across the world that even for persons who have had COVID-19 infection, that they get at least one dose of the vaccine. In some countries in Europe, they are doing single dose. In a number of others, they would wait a certain time, like about 3 months, and then do standard vaccination of 2 doses for those patients. What seems to be a recognized occurrence is that persons who had the COVID before and they take the vaccine, they tend to have a more robust immune reaction. They tend to have more fever, more chills, more body aches, etc. But again, it lasts for like 24 hours maximum. And all managed generally by things like Panadol, Tylenol, paracetamol.
And if a person is currently battling COVID-19, what effect would the vaccine have on them?
Right. So if they currently have COVID-19, it is not recommended for them to take the vaccine yet. We want them to recover before we give them vaccination.
In terms of long-term, persons are concerned about the development of the vaccine and all of that. And so far, we haven't had any real complaints about side effects and or any stories about that. But as a doctor and as somebody who's in the medical field, could you say if there are any issues with long-term developing complications down the line?
Yeah, well, we've only started administering vaccines for COVID-19, a couple months now. So it's a little premature to anticipate what the long-term, side effect profile may look like. What we do know are what are the complications long-term of having COVID and not treating it or not addressing it. We know those effects are devastating. There is a recognized entity called long COVID with lots of issues, including all kinds of pains, shortness of breath, chest pain, cardiac complications, psychological complications, psychiatric complications, etc. The vaccines have just recently started being rolled out across the world, just a couple months.
Mm-hmm.
But these are not things that were just produced and invented over the last year.
Mm-hmm.
In fact, the vaccine that is available in Guyana, the AstraZeneca vaccine, has been under study since the Ebola outbreak in 2014, 2016, so a minimum of 5 years. The world and scientists in general have recognized that our response to Ebola was not great.
Mm-hmm.
So they started the process of preparing for the next big thing since then. They, especially at University of Oxford in particular, they isolated something called an adenovirus from chimpanzee.
Mm-hmm.
And they used that, modified it, and used it as a vehicle to transport vaccine material into humans. Luckily, you may say luckily now, but the coronavirus is not new to humans. This particular type of coronavirus that causes COVID-19 is new, but the world has been exposed before to SARS, which is a coronavirus, to MERS, which is a coronavirus. So they know the mechanism, how this virus attacks the human body. And this is the thing called the spike proteins on the surface of the virus. So they put those modified spike proteins into this vehicle from the adenovirus and use that to introduce to people. Now you start to create defense mechanisms against the spike proteins. And the spike proteins are important because that is how the virus attaches itself to the human body. So if you can fight off the attachment, you can fight off the infection and the effects of it. And that's the whole basis behind, at least the scientific basis behind the AstraZeneca vaccine. It is not a new vaccine. We've been working, or scientists have been working on this thing for more than 5-6 years.
So the AstraZeneca vaccine, that is the only one that we have here, or do we have anything else?
So I believe we also have some of the Chinese Sinopharm, Sinovac vaccine. We're expecting the Russian Sputnik. We do not know anything or any availability of the Pfizer or Moderna vaccine or the Johnson & Johnson vaccine, which is a single-dose vaccine, the most recent one to have been approved for emergency use. And that is, you know, it's unfortunate because you see here world economics playing out on a grand scale. Those who are able to afford it have bought up all the Pfizers, all the Moderna, before production really started. And so countries like ours, we don't really have a realistic expectation that we will get the bulk of our vaccinations from Pfizer or Moderna. That's already bought up by, you know, the developed world across Europe, across North America, etc. And they have bought doses far in excess of their actual immediate needs. So we are way, way down on the priority list for those. So we have to focus our attention, and our expectations should be tailored to what we have, which is the AstraZeneca, which is the Sputnik from Russia, and the Sinopharm from China.
You spoke earlier about receiving your COVID-19 vaccine in a very organized fashion, and the unit that that administers the vaccine, they would have stuff set up in case of, let's say, side effect or something happening.
Yes.
I don't know if there's a monitoring period for persons who receive the vaccine, if they're keep in contact with the health workers or whatever, whoever is in charge. And I was wondering, this is just a question that popped into my head, if in case of a emergency as a result of taking the vaccine, which unit do you contact? Because we know you already have
So
a COVID-19 unit.
any emergency, not just COVID or vaccine, the best place to contact is the nearest healthcare facility.
Mhm.
It doesn't make sense to try to contact some place that is 100 miles away
Mhm.
if there is a health center 2 miles away, for
Mhm.
example. So in any emergency, that's the mantra. First point of contact is nearest healthcare facility or
Mhm.
healthcare personnel. So that's what we would advise. In terms of the monitoring, I know that I was called for the first 2 days at least
Mhm.
by the Ministry of Health to find out how you're doing, what side effects, if any, do you have any fever. There's a checklist that these guys have that they will call you, and that is why when you first go into the vaccination center, they take all your information,
Mhm.
your name, your date of birth, your contact information, address, etc., so that you're part of the database that they can monitor and follow you. And so, that is something that is recommended, so that when they call, they'll ask if it's the right person they're talking to, how you're feeling. Since you had your vaccines, did you have fever? Did you have any chills? Did you have any pain? Are you feeling fatigued, tired? Did you sleep? Headache? It's all kinds of stuff they would ask. And once you're good, that process is repeated again, I believe, on day 2. And I'm not sure that there was any follow-up after the first 48 hours, but I may be wrong.
In terms of the rollout of the campaign, we know that health workers some of them got their vaccine. I don't know how many.
Yeah.
Some elderly persons received the vaccine,
Yeah.
and some senior members of the government and probably of the opposition. Could you say who's next to receive? Would be next on the list?
We are still in the process of doing the over 60 age group and those with comorbidities.
Mhm.
What I can tell you is that as of Friday evening, we would have passed about 6,500 residents of Guyana who were vaccinated with their first dose.
Mhm.
And at the rate at which they're going, it's a very admirable
Mhm.
pace at which this is being done.
Mhm.
And so we do expect that we will get up to 20,000, 30, 40, 50,000, maybe by the end of the month, etc. These are very committed people working around the clock. Well, not quite around the clock, but there all the time.
I understand.
And it's a good team.
And the vaccines are being administered at the Georgetown Hospital, and
So there are vaccine sites across the country. All of the administrative regions have vaccine sites. We tend to focus a lot on Region 4. This is our main population center. I know in Georgetown there is a couple of centers. There are a couple of centers at the Ministry of Health building, the newer one on Brick Dam. I believe there's a tent there with several stations under there where the process goes quite smoothly.
Mhm.
On the East Coast, the Enmore Polyclinic has been an approved site, and they have been doing that. On the East Bank is the Diamond Diagnostic Center. And, over on the Essequibo Coast, Surrey Hospital, there's Charity Hospital there, New Amsterdam Hospital in Berbice, etc. So we've spread it out across the country, so every region has at least one place where the citizens and the residents could actually go and get vaccinated.
Mhm. So those of you who are listening, when the time comes, where you can go to get your COVID-19 immunization package or vaccine. In terms of, we were talking earlier about people who may not be eligible for the vaccine, how they protect themselves. But if you have the vaccine, is it safe? Would you say that is it safe for you to go back to doing things as normal as before COVID, pre-COVID?
Yeah. So again, very practical question. And the simple answer is that we still have to maintain the tenets of public health recommendations. Social distancing, wearing masks, and washing,
even after the
sanitization.
vaccine.
Correct. Because what we know for sure is that all the vaccines so far have proven to be 100% effective in preventing severe COVID. So if you get vaccinated, you're not going to be going to the ICU, and they're also been shown to be protective against death.
Mm-hmm.
So you're not going to be sick enough to be admitted to hospital, but you can still get the infection. It's
Okay.
just going to be mild to moderate. And if you get it, you can then pass it on.
Mm-hmm.
So that's the main reason for continuing to have these measures in place.
Mm-hmm.
And you can still then, if you take your mask off, you can contract it from somebody else, even though you have the vaccine.
We mentioned the AstraZeneca COVID-19 vaccine, which is basically popular here because that's the
Yeah.
one that we have.
Oh, it's popular because that's what we have.
That's what we have. But there were reports recently in the international media about suspending the vaccine because there were issues with blood clots. I'm not sure if you could speak to that, because there were reports in Denmark and Norway and Iceland and Bulgaria. How do you address such concerns?
Great topical question. It's very current, very modern. And it's important to know a couple of things. There's no evidence yet, and there might never be evidence to suggest that there is a direct link between the vaccine and the prevalence or the development of blood clots, bleeding, and low platelets in those who are vaccinated. And let me put that in perspective for you. Across Europe, 17 million people were vaccinated with AstraZeneca. Of that 17 million, 15 persons developed clots in the legs, and 22 persons developed clot in the lungs. 2 persons would have died as a complication of that. In the general population, vaccine or no vaccine, the incidence or the number of people who develop clots in the legs and the lungs at that level of 17 million would be several hundreds. So it doesn't quite add up. You know, in fact, in the studies that were done, over 60,000 persons were evaluated prior to the vaccine becoming approved for emergency use. There was the incidence of these things, bleeding, low platelets, and clots, etc., were less than in the general population. So at this point, there is no scientific evidence that links the vaccine as a causative reason for these things. Of course, once these things are noted in the heightened and alert state that we are in, looking for side effects, etc., people have to investigate further. But as of this moment, there is no causative link that has been shown. It's going to be evaluated. Now, another perspective. Across Europe, their supply comes from manufacturing plants in the UK. In Guyana and the rest of the Caribbean, our supplies come from manufacturing plants in India. And we have rolled out this in several 100,000 persons in the Caribbean, and we have not had any of those reports. And we are monitoring, despite our limited resources. Barbados, Jamaica, all the places, Guyana, everybody who has received the vaccine, they are monitoring for all these side effects. The Caribbean Public Health Authority, or CARPHA, has released a statement that, you know, strengthens what I just said to you, that our batch came from India and we have no reason to suspect that it's been linked to any of these conditions.
So basically, we have a different origin.
We have a different production site,
production.
but it's the same mechanism of action, etc. There may be a
Okay.
couple of transport material in the actual vials that are varying from one site to the next.
So COVID-19 is a complex, you would say, complex
Certainly
virus.
is.
We haven't figured it out as yet. We have a lot to learn, and we have different stages or strains of the virus,
Mhm.
and with that we have persons who would get really sick. Some of them would get to sick to a point of death, and some of them would not show any symptoms,
Mhm.
and you call them
Asymptomatic, correct.
asymptomatic. So those persons who are asymptomatic, you would say they are the stronger. They have a more resistance towards getting the virus, and they can fight it off more. When they get the vaccine, does it boost? What was the effect for them?
So, like any vaccine, you expect that they would boost an initial response, and when they get their second dose, that initial response will be strengthened or boosted. There are some defense mechanisms that are produced early after exposure, and some that are produced and then last for a long time, like lifetime or years, etc. Remember, again, we're only dealing with this so far for just over a year. That's the COVID-19 pandemic. So we don't know if, the virus will become seasonal. We don't know if it'll come around every year. We don't know that much about it because it hasn't been around that long. So we haven't been able to check to see how long the natural immunity will last. And we haven't been able to see how long the vaccine immunity will last. So we don't know if vaccination now becomes an annual thing. Is it that we are going to be able to turn this COVID-19 into like a common flu that you get vaccine for every year? We don't know.
You just touched on my next question because I was thinking, how often would we have to take this?
Yeah.
Because some immunization vaccines last 5 years, you don't need to take it.
Right.
And some you have to take, like you said, with the flu, some people have to take flu shots.
Yeah.
It's seasonal, so
it's just too early to know. We will see this evolve over the next months or years.
All right. So we're about to wrap up in the next couple of minutes. We'll take a short break, and when we come back, we'll continue talking to Dr. Carpin about the COVID-19 immunization and some of the work that he's been doing to help COVID-19 patients at the Georgetown Public Hospital.
Certainly. Leave here, I have to go.
Welcome back to the program. You're joining us on Your Health Matters, and we are about to wrap up. We have with us today Dr. Mahindra Karpin, who has been on the front lines among the medical persons who've been helping us to cope and battle this deadly virus, COVID-19, and he's here talking to us about the immunization process and what it entails. And as we are about to go, I will have him touch on some of the work that he's been doing with the patients, the critical patients, COVID-19 patients. He has been a part of the program to have patients benefit from the convalescent plasma, COVID-19, from other recovered patients, and he's going to touch on that a bit and tell us give us an update on what's happening there and how many patients would have benefited from that process.
Yeah, well, thanks for bringing that up. We're actually very proud of the convalescent plasma program that was started in Guyana, we were among the first, if not the first, in CARICOM to employ an old strategy to fight a new problem. First, let me just tell you a little bit about convalescent plasma and the science behind the utilization. When someone becomes sick with an infection, your body tries to produce defense mechanisms. And if you recover, then those defense mechanisms are in your blood. So we take the blood from recovered patients with the defense mechanisms called antibodies. And then we give that to a patient who is sick and not doing so well to try and boost their defense mechanism, to boost their antibodies. Now, there are some basic things that go into this, just like a blood transfusion. You have to make sure that the person is compatible so that they don't develop an abnormal reaction, etc. Now, we have been able to do that in over 75 patients so far. We have had like 2 persons who had what we call transfusion reactions and they had to be stopped. But the majority did tolerate this very well. And, there was, of those persons who got it, there was over 75% of persons who actually did well. Now, and especially in the early stages, when we didn't quite have the protocol worked out, who are the best candidates, who are the most suitable candidates, etc., we had waited a little bit too late in some patients. Remember, this is brand new, right? And unfortunately, a couple of those persons, especially in the early days, did not make it. But again, it's still a strategy that we would employ in the right patient at an earlier stage in Guyana. And we continue to do so in the right patient. And this is something that we're quite pleased about. And it involved a very strong collaboration, not just from the clinical team, but the administrative team, the ethics committee, the Ministry of Health, the blood bank, or National Transfusion Service, etc. So this was a collaborative effort of all persons with the singular goal of trying to help patients. Because at that time, when we started this program, there really wasn't a lot of, things that you could do to help these people. We had no high-powered medications, and, it took a while for things to get into Guyana from our situation, etc. So even now, there are a couple of things that are available elsewhere that we still don't have, but we're still managing. Our case fatality rate is about 2.2%. Across the world is between 2 and 3%. So we're on the lower side of what is average, and we're pleased about that. Of course, we lament and we mourn every person who did not make it, for sure. But it could have been a lot worse. We could have been, instead of 200 deaths, we could have been past 500.
Certainly. So we're talking about immunization, and we spoke a lot about the benefits and so on before. So just before we wrap up, I'd just like you to impress and emphasize on our viewers and listeners, those on Facebook and those across Radio Land, why it's important for them to be vaccinated, the benefits of the COVID-19 vaccine, and so on.
So for us to return to what we used to consider normal, you need immunity, or you need something to treat the infection. We don't have something to treat the infection, but what we do have is a measure to boost and build our immunity, and that is the vaccine. So until we find something to treat it, that we can cure it, the old statement remains true. Prevention is better than cure. So we take the vaccine to boost our immune system, to help us fight off the dangerous and the most severe form of COVID-19, so that you don't end up in the ICU, you don't end up on a ventilator, and you don't end up dying. And worse yet, you don't pass that on, or that risk, to your vulnerable family members and those around you, your older aunts, uncles, grandparents, parents, etc. So it's very important that we consider this as a reasonable approach to managing the COVID-19 pandemic. And, all the questions that have come, should I take the vaccine? Is it safe for me? Is it safe for my family, etc.? The vast majority of the time, the answer is yes. Take it, recommend it to your family and friends who are eligible to get it. The only person who should not take it are those who have a severe allergic reaction to vaccines in general, or any component of the COVID-19 vaccine. That's the only group that should not take it.
You said component. Could you touch a bit on that?
Yeah, so there's some, the vaccines come with various chemicals involved in there, etc. But I can't list them all to you, but it's easily found online, etc., on the vaccine package, etc., what those things are. And the other thing that people tend to get away with, they claim vaccines are linked to autism, etc. Well, that's not true. The scientific scrutiny did occur, and those linkages are not there. They were just propaganda.
Just in case somebody would want to know more about the immunization process and the vaccines and stuff, where can they go to get that information?
So the Ministry of Health has a website that can be accessed, as well as there are several numbers at the Ministry of Health and their health centers that people can call to get more information. But it's reassuring that every administrative region has vaccine center or centers that citizens and residents can go and have vaccines.
Well, that brings us to the end of our discussion today. We'd like to thank our guest, Dr. Carpin, for coming, because we know his schedule is very busy. He's a cardiologist, and the patients are waiting. So thank you so much, Dr. Carpin, for joining us and sharing all the knowledge that you have on COVID-19 immunization and vaccines. And thank you, our viewers and listeners, for tuning in and listening to us. We hope that you've learned something, and if you have questions, you heard Dr. Carpin say where you can get more information. The Ministry of Health has a unit, and we hope that you consider what he said and consider the vaccine, because it's optional, but it's better. The benefits outweigh the risk, right?
Absolutely.
So on behalf of our Kaieteur Radio production team, I wish you a pleasant rest of the day. Until next time, be kind to yourselves, and just bye-bye.
Thank you.